So since Tim experienced pain while sleeping, I think it's important to look at the sleep posture, because if he doesn't sleep well, then he's going to have pain during the day with functional activities. So it's important to not only look at physiotherapy treatment approaches, but also management strategies like sleep, arm position, neck position during the day too. So if he's having pain there with elbow extension, you might consider placing a towel and seeing what happens to his pain. If he's still feeling symptoms, you might place a pillow between his knees to reduce the pelvic effect on the spine. And if he's still feeling symptoms, his neck is fairly supported. Sometimes you get patients who's not as supported. You might do one of two things. You might just roll the towel, support his neck, and see what he feels like that. If he feels comfortable and is able to sleep, that's good. Otherwise, supporting his neck, take it here. I'll just put this underneath, put in the towel. So looking at sleep positions is important, apart from what he does before he sleeps, whether he's watching TV or using his mobile phone, which also has an effect. So looking at his alignment, arm position, even getting a bit more neutral, is equally important in his management. The next part is looking at the biomechanics.
Yeah. With the sleep, Peter, sometimes I get patients to get a towel and put it in the tumble dryer so it's nice and warm. And they fold the towel, so it's approximately 30 centimetres high, and wrap it around their neck, and they can pin it or tape it at the front. That gives them, the heat will often help the muscle spasm, and the towel can just give them a bit of support, and that can often help them
That's a brilliant idea.
To sleep in the position. Sometimes the commercial hot packs you can get in that long shape can fit around the neck. Just don't let them burn themselves on the hot packs if it gets too hot. Usually the tumble dryer is not too hot, but often they'll need that support. Do you often recommend soft collars?
Yeah, I get them to sleep with a soft collar.
Yeah.
If it's too difficult, I might get them to place it back to front.
Yes.
But you're looking at relieving their symptoms. So if they're having issues sitting in front of the computer and neck flexion is a problem, then I do give them a cervical collar.
Yeah.
Because you're looking at, if it's pain relieving, work with that.
Yes.
So I agree with you that, there might not be lots of research for it, but we are looking at this patient in front of you, trying to help them like the Good Samaritan.
Yes, yeah. And so if sleep's their main issue, really look at their sleep. If it's their work position,
that's right.
Look at that. If they have trouble even sitting up, what can you do to help them with that?
That's right.
So it's got to be really patient-centred, doesn't it?
That's right.
Yeah.
I know our colleague Gwen Jewell is very strict at the specialist examination. You can do all the lovely treatment, but you need to look at what's happening to the person during the day. And I think that's very important. Really.
Yeah, it's treating the person and the problem.
Person and the problem, that's right, yeah. I like the tumble dryer. I'll try that. So this is taping. This particular person had a downward rotated scapula and protracted. So trying to see, as I did in the initial assessment, where elevating the scapula it reduced their pain, whether we could continue at home. So this was coming from under the axilla. I put skin prep. So when you apply the Leukoplast, you get him to shrug. If it's not, you can support it. How's that? Okay. Well, and relax for a moment. Coming on the inferior part of the. Make sure it doesn't go under the skin. So hyperfix and then the Leukoplast.
Yes.
And ensure they are not allergic to tape.
Yeah, I always like that. Yeah. You don't want to find out the hard way.
That's right. I must thank Jenny McConnell for inspiring me with taping. And relaxing. So it's more elevated than earlier. How does that compare to before?
Yeah, it's down to
6 there. So I get them to continue at home. If it's less than 20 degrees, maybe 2 days on, 1 day off over 3 weeks. Or if it's over 20 degrees in Melbourne, 1 day on, 2 days
so
off. Of course,
give them a chance to recover. So it doesn't get
humid, it's a bit
sweaty. Yeah.
And also it helps the family to get involved too.
Yeah, okay.
In their management. And I find it takes about sometimes 3 weeks for habit to change.
Yes.
So
Yeah.
it helps them to change their
Yes.
biomechanics, and also it's maybe a neuromuscular approach rather than just only biomechanics, you know. So the next step with this patient, we've done a few on the first day. Most probably advice was the important part. The taping
Yes.
was one, but the hands-on was doing manual distraction, like the Carlton bond technique. So since manual distraction eased his pain, we could use that as a treating strategy. We might do a like grade 4 minus or 4 grade 4 triple minus if it's very sensitive, and constantly speaking to Tim and assessing whether there's any change in your pain, especially if it increases, then you can sort of modify it. So I'm coming close to C6, C7. So this is a Carlton bone technique, and I'm doing like a 4 minus, gentle distraction, and holding for 7 seconds and relaxing for 3, and you'll perform 6 repetitions initially, which is then really about 1 minute. Now, Tim, how is that on your arm when I'm performing manual distraction?
Yeah, it decreases the pain.
Decreases pain.